Good morning, friends. Glad to have you with us here for the top of the 9 o'clock hour on Good Day LA. I'm Michele Pereira. May, as we've been telling you, and as you well know, is Mental Health Awareness Month. We're trying to help get out the message that the pandemic has led to a growing mental health crisis. Some of the leading voices in the field are getting together to talk about solutions, right? Solutions are what matters. The doctor putting the whole thing together will join us this morning. The month of May is Mental Health Awareness Month. There may never have been a more vital time to shine a light on the need for mental health care. We are all too aware of the health impact of the pandemic as we get closer and closer to 1 million deaths, 1 million souls lost to COVID. But there has been an enormous mental health impact as well, and there is an increasingly pressing need for mental health services. That's the topic of a new report coming out from the Chicago School of Professional Psychology. One of the people we often turn to discuss these matters of mental health is Dr. Michele Nealon, who is, by the way, that school's president and the co-author of this report. This is something that you spend so much time, energy, and focusing your smarts on. It feels more urgent now, does it not, Dr. Nealon? It's always been a problem in our country.
It's very urgent, and good morning to you, Michele. And I will tell you, top of this conversation is you are part of my inspiration for having this mental health summit tomorrow. Since you and I have been talking about mental health issues on air, my social media platforms are popping. People are saying, thank you for raising this conversation. I feel seen, I feel heard. But now it's time to dig deeper into this. 1 in 5 adults have a mental health issue, 1 in 6 children. But we have to addedly talk about the social determinants of health that are in part driving our crisis. And people don't like to talk about these topics. They are race, gender, poor education, low employment, lack of access to safe communities, housing, and also to transit. The social issues and contexts in which people are living are really contributing to these mental health issues as well as the physical issues that are coming along with it. And that's what our summit is about tomorrow.
You know, it's so interesting that you point that out, because I was listening to you list off of those factors, and the same parallels can be made to healthcare, right? And even COVID, when we look at the outcomes of people of color and COVID, right? How it disproportionately affected them more, us more. It should be no surprise, yet it is not getting the attention, the mental health aspect.
It's not, including by healthcare providers. And to give your viewers a sense of what you just referenced here, for Pacific Islanders, indigenous populations, Black and African Americans, Latinos, they were twice more likely to die during this pandemic. Women now make up, than white and Asian Americans. Women now make up 36% of global employment, but they accounted for over 50% of lost employment during the pandemic. Life expectancy for African Americans has dropped 3 years, and for Latinos, 2 years and 9 months. These are big issues. Michele, 70% of our youth in the juvenile justice system now have at least one mental health problem, over 40% for adults. These issues, the social issues, are not getting the attention. And as a result of that, we're not correcting the issues, and we're not developing optimal health care practices.
So you know, you dropped that data on us. 1 in 5 adults, 1 in 6 children are dealing with a mental health crisis. I mean, to me, it sounds as though you're saying that if we're not careful, we're going to be in a mental health pandemic.
We are in a mental health pandemic, and we were in a mental health pandemic before COVID-19, and it has been exacerbated. Part of the issue here that we just can't get to, these are deep-seated inequities in our society. Even medical professionals, mental health professionals, they feel that they're so deeply rooted that we just can't get to it. And so more and more of our time is not spent bringing holistic care. Tomorrow in Los Angeles, the Chicago School is headquartered in Los Angeles, but we have campuses across the country. So here in LA, we're bringing together AltaMed, we're bringing the Los Angeles County of Education, the LAUSD, community organizations like Para Los Niños, and many, many others. And then in Washington, Dallas, and DC, like organizations there, because we have to start saying, okay, we get it, we get the pandemic, but let's now start talking about
What's
these
coming in
very
its wake.
complex social issues and come up with solutions.
And by the way, the organizations that you just referenced and many more like it in various cities across the nation, they are front lines, right? They are seeing this up close and personal with the people they serve.
They really are. And for anyone listening in that says, these are not my problems, I'm actually doing okay. My life's okay. My kids' lives are okay.
Yeah, tell them why it matters.
It matters at the personal level. I'll go through 4 things real quickly with you, Michaela. At the personal level, people that have mental health issues are significantly more likely to have chronic illnesses such as diabetes and cancer. At the family level, for families that have a family member with a mental health illness, they are providing on average 32 hours of unpaid care in their homes. At the community level, I already mentioned to you, 70% of our kids that are in the juvenile justice system has a mental health issue. What is that? Warehousing of the mentally ill? Come on. And then at the world level, depression is now the leading illness, the leading cause of disability in the world. And it accounts for, at minimum, $1 trillion of lost productivity. These issues impact all of us. Yeah. It's our lives, our community.
Okay, before I lose you, if I were to give you momentary magic wand powers and just wave a wand and you could do one thing, one systemic change in our healthcare system to elevate mental health to a top priority, what would it be?
It would be getting the attention of those that have influence and have the power to open up the purse strings and build the workforce and provide the resources for mental health professionals.
Well, where you're starting is with your summit tomorrow, the State of Mental Health Care Summit tomorrow. Experts from medicine, education, mental health. We wish you great success with it. We hope there's really substantive conversations and, more importantly, solutions that come out of it. Dr. Michele Nealon, it's always a delight to have you on the air, and it is a privilege to have these conversations with you. She is the president of the Chicago School of Professional Psychology, and a blessing. Thank you, sis.
Thank you, dear Michaela. Bye-bye.
Take care. Take care.